So, as a clinician who is currently prescribing anti-amyloid treatments, I thought the most impactful presentation was given by Dr. John Sims, who showed that if you more slowly up-titrate the concentration of donanemab, that the rate of ARIA can be essentially halved. So this is really important information that we intend to institute in our clinics. And we think by slowing the initial titration of these anti-amyloid treatments that we can make it safer for patients. So this is really helpful information for us to have because, of course, we want to provide these treatments as safely as possible to our patients.